Uh, Hello, everyone. Good evening.
Good evening, ma'am.
Good evening, everyone. Is it possible for you all to keep your camera on as we have promised yesterday? Rupa, Priya, Kalranjit, Farhad, everyone? Yes, I can see Rupa on my screen.
Very cold, ma'am.
Oh, hey, you got cold. How?
No, morning in Canada, it's very cold. It's only
Oh,
14
it's
degrees.
cold over there.
Yeah.
Okay, fine. So, and what about everyone else?
I would like to thank you for the notes, ma'am. It's really
Yeah.
helpful. Thank you so
So
much.
was it was it eligible? Like, could you all understood whatever was written over there?
It's a bit difficult, but since we listened to your class, it made us easy.
Yeah.
If you don't
This
listen
is
to your class, then it's like Greek for us.
yeah.
Yeah.
Actually, that's why I have asked you to first go through
Evening, ma'am.
my good evening, Kalvanjeet.
And the questions are very tough, ma'am. Like 10 times I have to think to answer. Oh boy.
But did you manage to get 50% out of that?
I think so, ma'am.
Yes,
Yeah,
ma'am.
I got
I
it.
got 16 out of 20.
You got 16 right out of that's good. That's what I actually expected from you all to get. I'm sorry. Anyone?
So,
Yes, Priya.
Hello, good evening, ma'am.
Good evening. Okay. So we will have a lot of discussion today as we are starting with uh, actual your respiratory system. Okay. So kindly get started. And now we are going to discuss a lot of about asthma, your COPDs, and not many diseases today. So I really want everyone to first show me your faces so as we can start. Give me 1 second. Just give me 1 second.
Hello.
Yes, I can see Fatu today. Good
Yeah,
evening,
yeah,
Fatu.
good evening. Good
Good
evening.
evening.
How
Yeah,
are
good
you?
morning. What's your time over there? Yeah, I'm good. How are you all?
Yeah, it's 4 p.m.
It's 4 p.m.
In
So
the
good
East
evening. You're
African
from?
country, Kenya. Yeah, yeah.
Okay, you're from Kenya. Yeah, I
I'm
had
from Kenya.
student
Yeah, yeah.
earlier. They were from Kenya.
Yeah, yeah. I'm from Kenya. Yeah. And
Okay.
this is my first time here, and I hope to at least tackle some very challenging questions, just like my fellow nurses have stated that they've been having some good time and some a little bit of critical thinking in nursing. I look forward to the same because, yeah, as we are all preparing for these exams, I really want to know more and, of course, get to learn more in the nursing fraternity and, of course, manage as many conditions as possible. Yeah.
Yeah, definitely. Okay, so my goal is to make you understand each and every topic very clearly. Apart from that, you understood the topic means you don't have to memorize everything. There's something called memorization, something called understood. If you understood the critical question, you don't have to memorize. You don't have to learn anything. Yeah, good evening, Usma. You don't have to focus on memorizing. You just have to focus on understanding the concept because this is the key which is going to pass the exam. Understand one thing, the people, the board who are taking an exam, these are a very specialized people. They know what exactly happening in clinicals, first of all. So if you learn the fact, because facts are available everywhere. You don't have to memorize, you have to conceptualize the things. You have to prepare yourself in a such a way that you are competent enough to appear in a critical situation and think like a good competent nurse. Okay, one thing is very clear. Second thing, you are given an exam. It is not a competitive exam. This is a competent exam, which straightforward state that are you eligible? Are you eligible to be a nurse or not? Simple. This question asks you such basic type of question. So if you are not critically prepared yourself as a nurse, if you're not thinking so many horizon or like so many other ways, then it's very difficult for you to pass this exam. I'm very like surely I'm saying this thing. Okay, can we start? Okay,
Yes, yeah.
so let's start then. Let's just straightforward. Let's start with the topic. Can you just tell me one thing, any one of you, what we have studied yesterday? Anyone?
Ma'am, we have
Studied it.
studied yesterday respiratory tract
Yes.
from on the floor. How's the respiratory going? So then after that we have studied normal lung sound, abnormal lung sound, and
Okay.
medical emergencies. Then
Okay.
all the how's the volume will be decreased and all pressure will be increased, like how it works.
Okay. Cool. Okay. So this is what we have studied still. Okay. Let's come to the next topic that we're going to discuss today. Can you all see the screen? Yes or no? Can you see the screen over here, whatever I'm writing anything?
Yes, ma'am.
Yes, this is what exactly I want. Respiratory. So let's start. So in respiratory, as we have studied till now about the basic of respiratory, now we will understand the disease condition. The first disease condition is your obstructive lung diseases. Lung diseases. What is the disease called?
Ma'am, there is showing some error on the screen.
Which kind of error can you which kind of error can you just tell?
It's showing resource loading failed. Please try again later.
No, ma'am. I
But
can see
I can
respiratory,
see
but the writing
Farhad.
is not clear, ma'am.
Okay. Is this not clear to you all?
It's breaking.
Yeah, but can you
Yeah.
understand whatever? Can you just
Yeah.
make it out what I'm writing?
Yeah.
That's what matters. Okay. So exactly that's what matters. Okay. So let's talk about obstructive lung diseases. Understand one thing very clearly. I'm not talking about COPD. I'm talking about obstructive lung diseases. Okay. So there are so many diseases which can come under obstructive lung diseases. The first one is your asthma. You can call it asthma. You can call it asthma. Second one is your chronic bronchitis. Okay. Third is your emphysema. Okay. And the fourth one is your, can you see all?
Yes.
Yeah. And the fourth one is your bronchiolactasis. Bronchiolactasis. Okay. So these are the 1, 2, 3, 4. The 4 diseases which actually come under obstructive lung diseases. Okay, understand what? There are 2 types of lung diseases. One is obstructive lung diseases. Second is restrictive lung diseases. And third comes under other category. So if I make my lungs over here, so just look at this. So can you see this is my lung? Okay, this is what is this? This is your
I can't see,
this is
ma'am.
your you can see.
No, ma'am. The screen stopped under chronic bronchitis. That's it.
Ma'am, it's showing everyone's name on the screen like this. Like on the side of cursor, everyone's name is with the cursor.
Can you just give me 1 second? Because I can see the screen. I don't know what is the problem. Can you just give me 1 second? Just give me 1 second so I can rejoin. And because if it's showing problem it's showing problem to all of you, it means that something problem in my system. Let me go and get it again. Okay, just wait for me.
Last year.
Can you all see me now?
We can see you, ma'am.
Yes, you can see you.
Well, now.
Recording in progress.
Yeah,
Now
now
can
we
you
can
see?
see the share screen.
Yeah, then it's good. Now let's start again then.
Yeah.
Okay, so let's start again. Okay. Okay. Is this good? Is this visible to all of you?
Yes.
Yes, thank you for the acknowledgement.
Yes.
Okay, someone. Yeah, now it's good. Okay, so we were talking about obstructive lung diseases. Now it's visible. Yeah. So
Obstructive lung disease. Yes, ma'am.
So there are 4 diseases which come under obstructive lung disease. First of all is your asthma. Okay. Second is your chronic.
bronchitis.
Chronic
Very good. Chronic bronchitis.
bronchitis.
Third is
emphysema,
Emphysema.
Very good. Emphysema. And then
bronchial asthma,
we have bronchiolitis. Okay. So there are 4 diseases which come under your obstructive lung. Okay. So we will go one by one.
bronchiolitis, and bronchial asthma also. No?
No, asthma, bronchial asthma doesn't mean anything. Listen, asthma is okay. So asthma, chronic bronchitis, emphysema, and bronchiolitis. So anyone, if you're not putting your audio off, it will be very difficult for me to continue. Okay, so these are the 4 obstructive lung diseases. Okay, apart from obstructive lung diseases, we have other type of lung diseases which is called a restrictive lung diseases. Okay, we will discuss this later. And then we have one more type of lung diseases which include all other, apart from this, for example, your pulmonary, your lung cancers. So these come under in a different set of others. So you have 3 type of lung diseases: obstructive lung diseases, restrictive lung diseases, and the third category is others. So for today's, our goal is to complete all these 4 disease conditions. Okay, understood? Okay, so let's talk about the first thing that we're going to talk about is our asthma. Does anyone of you, so we're going to talk about asthma. Okay, so anyone of you ever met a person who had asthma? Anyone of you, anyone having asthma right now currently? No? Any? Okay, so let me talk about asthma. So if you define asthma, it is a situation where it is an inflammatory condition of your lungs. Okay, so what is happening? It is an immune mediated. Second thing, it is a immune mediated. So what happens actually in asthma? Can anyone tell me if you have any previous knowledge about these kind of lung diseases?
It is reversible, ma'am.
Due
it is
the
reversible.
cause of this, it's a bronchospasm, ma'am. Due to bronchospasm, there will be
It is a smooth muscle hyperreaction.
inflammation of airway.
Yes, it is an inflammation of your smooth muscle. Okay, so it is an inflammatory condition of your lungs. It is an immune mediated in which the smooth muscle of your respiratory get hyper reacted. Okay, tell me one thing. So just understand one thing. As I have told you about anatomy and physiology yesterday, so this is your trachea. Okay, so trachea is lined by smooth muscles. Yes. Okay. So there are specialized columnar epithelial lining over here. And there is cilia present.
Yes, ma'am.
So what happened? For example, you are just passing by an cotton mill. Just imagine you are passing by you're just passing by a cotton mill, or there are so many pollen grains around you, or so in the month of October and November, when there is winds are blowing very fast and there is so much pollen all around your environment. So understand one thing. So whenever there is pollen grain will be present in your airway, what will happen? What normally should happen? These cilia should move this pollen grain out of your lungs. But if a patient is having asthma, what will happen? These cilia or these cells, what will happen? These pollen grain will act as antigen into our body. Okay, antigen. So these pollen grain will act as antigen in a body, and due to this antigen, there will be an immune reaction will happen. Whenever you have immune reaction, your body will get the blood vessels which are lining your trachea, what will they happen? What will happen to them? They will get over dilated. They will get over dilated, and there will be an increased influx of inflammatory mediator, which is known as mast cell. There will be an increase in the value of IgE, or there will be increase in tissue necrosing factor. There will be an increase in we have monoclonal antibodies, or there will be an increase of interleukins. So what are these? Your mast cell, your IgE, TNF alpha, your monoclonal antibody, or interleukins. What are these? These are the inflammatory mediators. So whenever antigen is present in our body tries to protect ourselves. So in order to protect ourselves, there is a massive vasodilation. So there is a VGFR also, growth factors also. So there is a massive influx of immune mediator, which are this mast cell, IgE, tissue necrosing factor, monoclonal antibodies, interleukin, your vesicular growth factors. So these will increase in number. And when these will increase in number, there will be an overdilation of blood vessels around this, and they will increase in secretions. So they will increase their secretion. So they will increase their secretion, and there will be a vasoconstriction with increase in secretion. Did you understood, or should I repeat this again? Let me repeat this again in a very easy form now so you can understand. Understand what is happening actually. So just understand there is an antigen. Antigen is your pollen grain. Okay. Understand one thing. So pollen grain is entering in your airway. So our body consider this pollen grain as an foreign body, and it start producing so many inflammatory mediators. So these inflammatories are mast cells, okay, your phagocytosis, your eosinophils, your basophils, your neutrophils, your TNF alpha, TNF, okay, interleukins are produced. There are different type of interleukins. There is growth factor. So what these immune mediators do to your airway? So they increase this secretion into your airway, and hence there will be an vasoconstriction, okay, and there will be increase in the secretions. Did you understood, everyone, or should I repeat again? Rupa, Patu,
Good, ma'am.
Govindraj.
Understand, ma'am.
Understood?
Yes, ma'am.
Yes, ma'am.
Everyone. So this is the pathophysiology of how actually you're having asthma. Okay. Okay. So one thing I want to make cell. So there is a big mast cell. So whenever you know what mast cells are, these are an immunoactive substance which is produced in your body. So these mast cells contain granule. So these mast cells are the granulocyte, and they have something called histamine into them. Histamine, okay. So mast cells, they have granules which is called histamines. And do you know what histamines are? Have you ever heard of S2 receptor blocker, histamine, antihistamines? Yes or no?
Yes, ma'am.
So, okay, and I want to teach you drugs also. So it's better you understand the pathophysiology also at the same time. So if I will teach you drugs, so you can correlate both of them, and it will become very easy for you to understand drug. Because if you understand the disease progression, it will be easy for you to understand why this drug is acting and how this drug is acting. So it is very important for you to understand the pathophysiology first. Okay, so what happened? There are histamine receptor present in your airway. Okay, let me make this thing very more clear to you. So, if this is your airway, so if this is your airway, have small receptor, which is called histamine. There are different of histamine in our body. There are different type of histamine receptor in our body. Depending upon their location, it differ in their action. So, if the histamine are present in your airway, what will they do? they will vasodilate these blood vessels, and there will massive secretion of transudate into your airway, and they will increase in the secretion. There is a vasoconstriction, and these histamine also produce running nose. So this is the role of your histamine. Okay, so do you know, understood where the histamine are coming from? They're basically coming from your mast cell. Okay, so if I will teach you why are we giving antihistamine in respiratory or asthma, you will get clear. Yes. Okay. So till now we understood about what is the pathophysiology of this disease. Now understand what are the type of asthma. Okay. Okay. So in order to understand the type of asthma, listen, there is only basically two type of asthma. First is your atopic asthma, and second is your non-atopic asthma. Okay. So there is only two type of asthma: atopic asthma and atopic asthma. Atopic asthma, no, not, you can just like, okay. Atopic asthma and there's non-atopic asthma. Okay, so there are only two type of asthma, to be very specifically, and some people were calling like bronchial asthma. Listen, if I teach you very clearly, so asthma happens only in your lower respiratory tract, basically in your trachea and in your bronchi. Okay, asthma basically affect your trachea and your bronchi. Make this thing very clear in your mind. Okay, these are the only two locations which is, so you can have tracheal asthma, you can call it bronchial asthma. Okay, it's just depending upon the location where it is happening. This is all. But if I talk about types, so there are only two type of asthma, which is atopic asthma and non-atopic asthma. Atopic asthma is IgE mediated. Okay, so it IgE so it like, so it is basically affected by your if a patient is have a history. So if the parents are having a child, could happen. So mostly seen in children, atopic asthma. Okay, so they're immune mediated reacted. Okay, okay. So for they are having any kind of allergic. So they are being allergic to something. That's why this is IgE immune mediated. And there's second type of asthma, which is IG, where there is this is not IgE mediated. So in this patient, they will have IgE normal, but here you will have increase in IgE value. Okay, okay. So this might be induced due to cold weather. Okay, some people have asthma in cold weather, so there is no kind of allergen. Is not only there's a temperature decrease, and that's why your patient is having asthma. Okay, so there might be a drug induced. So you know there's one special drug, which is this drug. I'm telling you now. Remember, it's for lifetime. There is drug which is called as aspirin. Aspirin induced asthma is there. Okay, aspirin induced asthma, which is not, there's no antibody present, but this, it is not immune mediated. So if the patient is having asthma due to cold weather, or if a patient is having asthma due to drug like your aspirin, so these are come under non-atopic asthma. Understood? And if I talk about atopic asthma, you should be very clear. For example, a patient is having asthma due to pollen grain. So our body consider pollen grain as a foreign particle and try to attack. In order to attack, it produces so many inflammatory mediators. So when inflammatory mediators occur in the body, there is inflammation, and there is inflammation, there is bronchoconstriction, and there is increase in secretion. So this is what your asthma is looking like. Okay, and yeah, so it can be due to infection. Okay, it could be due to drug, and here it could be due to your pollen grains. Okay, and allergic to peanut, allergic to dust. It can be any allergic reaction, or it can be due to occupational asthma. If a patient is working in a silicosis factory or biogases or sugar cane factories, they can have silicosis, they can have mica. If they are working in a construction, they can have a mica, asthma due to mica. Okay, so there are different type of, or there is allergic. Basically, these are allergic. Understood the different two types till now? Understood the pathophysiology, understood the location where this asthma is happening, and did you understood the type of asthma?
Yes.
Okay. This is what exactly is. You will have to understand this thing because this is exactly what disease is. Okay. Don't go anything beyond this thing because this is the maximum that you should know about this thing. Okay. So till now, you have understood the disease. Okay. I have taught you how and what this disease is doing to your body. Okay. Now you have to tell me what is the sign and symptom of this. You tell me
Shortness of
what will
breath,
be the start.
cough,
Cough,
wheezing,
shortness of breath.
Yes.
chest tightness. They use
Yes.
accessory muscles.
Yes.
Hyperinflamed chest.
Cough,
No,
wheezing.
Wheezing
no,
sound.
hyper, no, please don't listen one thing. Okay, you're going wrong. So I have to teach again. There's no hyperinflamed is not a classical sign of the disease. Okay, what is this? Can you tell me? Can you tell me what is this?
Trachea, bronchial,
Trachea.
Yeah, what is this?
Bronchi,
Class, bronchi, very good. What is
Yeah.
this?
bronchioles.
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 Okay,
Okay, what is
okay.
this? What is
Alveoli.
this?
Alveoli.
No, alveoli are the air sacs.
I taught you.
This is trachea. Then
Terminal
and
bronchioles.
bronchi.
इतना जल्दी हम टर्मिनल तक पहुंच
From the
जाएंगे.
trachea, from the trachea
No,
to
ma'am. Primary bronchial,
Very good.
bronchioles.
Primary bronchioles.
secondary
Then you
bronchial,
have
secondary,
secondary bronchioles. Then you have
tertiary,
tertiary. Then you
Tertiary
have
bronchioles.
and
then you
terminal,
have
terminal,
Bronchioles.
then you have
respiratory
Respiratory
bronchi,
bronchioles.
then you have
alveoli,
Alveoli. Alveolar duct.
then you have
then alveoli.
Alveoli.
okay. Can you just appreciate the bifurcations? So if a patient is having, I told you, asthma basically affect your upper these things and these things, okay? Mainly, chiefly. And the thing that you're talking about hyperinflamed, so just understand this is the location where asthma is basically happening in the patient. Okay? Understood? Now, so all the congestion is happening over here.
Trachea and bronchi.
Yes, basically your trachea and your bronchi. Okay? Because understand these are very muscular, okay? These are very glandulars. Over here, there is cilia which is protecting you. Over here, there is macrophages. Okay, so if as you will descend down, there will be in morphological as well as there will be change in anatomy of these airways. Okay, understood? These are the very granular area, so there will be more secretion as compared to this. Okay, that's why asthma affect this and this area. Understood? So now tell me the
Yes,
sign and symptom.
ma'am, why I talk about this? Because yesterday you sent some of the notes, right? So in that it's written inflamed chest like a pigeon.
There will be, just strike that out. Okay, just strike that out. If it's written, just strike that out. Okay, nice. The first sign and symptom of patient come with.
Shortness of breath,
Okay, next.
cough,
Cough, very good. Next.
wheezing,
Yes, why wheezing? Why wheezing? Can you tell me? This is the air. What?
Anxiety.
Yes, a patient will get anxious. Yes, if there is asthma attack, a patient will get anxiety. Yes.
Wheezing, coughing,
Yes,
chest
wheezing.
tightness.
Yes, there will be chest
Chest
tightness.
tightness. Yes.
Next.
Uh,
Use of accessory muscles. Why? Because your diaphragm will be ineffective to provide that negative pressure in your lungs. So you need the help of your accessory muscles, your sternocleidoid muscle, your scales muscles in order to fulfill the requirement of your body. Okay. Next. Next. Dyspnea. Any other sign and symptom you remember? Or you think it should come? Cough with sputum? Yes or no? There will be a sputum.
And sometimes patient coughing, dry coughing.
In asthma, you don't have dry cough, basically. In asthma, it will be over hypersensitivity. There will be, and mucus will present. Okay? Most of a productive cough. Okay? Understood? Okay. Next, understand. Okay. There will be a bronchospasm can happen. Yes. There can be a bronchospasm. Yes, you can have also bronchospasm. Okay, tell me one thing. If there is an obstruction in the airway caused by bronchospasm and increase in secretion, will your body get enough oxygen? No. Okay. So,
Madam,
will
low
there be...
oxygen saturation होगी.
Sorry?
Low oxygen saturation patient.
Yes. So, will there be change in your SpO2 and your PA2 values? Yes or no? There will be a change in your SpO2 and PA2. Okay.
Yes,
So, tell me one thing. Will there be an easy exchange of gases? No. Will there be buildup of carbon dioxide in your body? Yes or no?
Yes,
So
ma'am.
if there is increase in the carbon dioxide, the pH will go down.
pH will go.
Will it lead to your respiratory acidosis? Can it lead to acidosis? Yes. In severe cases, it can also lead to your respiratory acidosis. Okay. Okay. Next. Okay. Apart from this thing, let's understand one more thing. Can you tell me the triggers which can cause asthma? What are the triggering
Smoking,
agents?
ma'am.
Smoking, yes.
Then cold air.
You need to understand why smoke. Basically, smoke disturbs your cilia, which is a very protective mechanism of your body. It reduces your immunity, your cellular immunity. If you disregard your cilia, it will be very easy for the antigen to react in your body. Understood why? Cilia was helping you to clear your airway. There's no cilia. Cilia is being distorted by your smoke, and this can happen. Understood? Smoke can cause, yes. Next.
Any
Allergy due to peanut? Yes. Due to smoke?
Madam, tuberculosis patients, COPD patients.
Yes. If they have already any kind of respiratory problem, they can cause. Okay, but this is not an exactly, but yeah. If the patient is having upper respiratory tract infection,
Yes.
they can have, okay. It can be due to exercise induced. So when there is exercise, there is increased demand of your air, and as there is a constriction of the bear, or due to then stress relieved.
Yes.
Stressed.
Chemical irritant also, ma'am.
Yes,
If we have any
Did you know
relation
when,
of...
you must have seen people when they are under so much stressful condition, they have a difficulty in breathing.
Yes.
If you speak hospitalized patient, you have convinced.
Yes, ma'am.
It happens when you're so much emotionally activated. Either you are happy, either you are sad. So in both the cases, there is an increase in an autonomic nervous system of your body. Basically, any emotional situation increase your autonomic, especially your sympathetic nervous system.
Yes,
so this trigger your asthma. Okay. Next, understand allergens. Okay. Next, cold air. Cold chemical
air.
Working in a chemical factory, it can cause. Okay. Yeah. Cool. Understood till now? So,
Yes, ma'am.
okay. How will you know that the asthma is okay? Is this asthma is a chronic condition?
Yes, ma'am.
Yes, it
Yes,
is a
ma'am.
chronic. It is a chronic condition. Okay.
And it's a
Nowadays,
heredity also.
nowadays, asthma was not earlier people didn't had asthma. If you talk about like 50, 60 years ago from now, it's very new and very modernized disease. It is just due to the pollution that is being happening in our environment. Earlier air was very clean. If you consider India and Canada or New Zealand, there's a difference in the air quality. You have lived in both countries, so you are very much aware of this fact. So earlier it was not it's not a very old disease, it's a very new disease. Nowadays, even if a person is having asthma, it was happening in much later part of your life. But nowadays, even a very children born country like a state like Delhi, Mumbai, there is so much of pollution over here. So children are getting asthma, and it is very common nowadays. Asthma is very common. I don't think like when we were kids and very rare student they had asthma, and they were they had their MDI in their pockets all the time. You remember in your school time you might have seen some students, your friends or something. Nowadays are very common. Like it was 1 or 2 students per school. Nowadays every 1 or 2 students per class nowadays is happening like this. If you study the statistics, so it's very bad. Like we are just polluting our environment so much that eventually it's affecting our heart and lungs and kidney, everything. Okay, so let's talk about like asthma. Okay, how will you diagnose an asthma? What can you do to diagnose an asthma?
Ma'am, they will do pulmonary function test.
Yes, very good. Pulmonary function test. This is what I really wanted to know. What is pulmonary function test? Its name itself suggests that it will assess your functions of your
muscles.
pulmonary.
Yes, ma'am.
Yes, your respiratory muscles. What your lungs is made up of, to inhale air, exhale air.
Exhale.
If there will be a blockage in your airway, it will not, your lungs, with the function of your lungs will get compromised, and there will be change in the pulmonary function test.
Yes, ma'am.
Okay, so let me just tell you an example of pulmonary function test. So there are pulmonary function tests comprised of so many things. First of all, it comes like spirometry. Okay.
Yes, ma'am. Yes, ma'am.
There is a handheld device.
Test.
Okay.
Chest X-ray भी करेंगे. Chest X-ray भी करेंगे.
You can do chest X-ray. Yeah, you can do chest X.
Allergy test.
Yes. Yes. Okay. Handheld device. Okay. Spirometry, and there is your pulmonary function test. Okay. So what happened in pulmonary function test? They were a patient. Okay. So madam, this is an airway. Okay. So this is the nose, and this is the mouth of a patient. So we will ask a patient to put a mouthpiece into the mouth. Okay. It will connect it to a machine, and there is all the instruction written on this chart in the keypad. Okay. So we will first of all ask the patient to exhale. Simple exhale. Like we're asking the patient to exhale. Okay. Okay. We will ask the patient to relax. First of all, we ask the patient to relax yourself. Then you will ask the patient to exhale and inhale. Like for example, you're asking the patient to exhale. Okay. Exhale. Okay. The patient relax now. And then you're going to clip the nose of a patient. Okay. And then you will ask the patient to keep this mouthpiece into the mouth. And you ask the patient to breathe out. Okay. Breathe out into the machine. So what will machine will do? Machine will...
Peak flow meter ये test होता है ना? Peak flow meter.
Peak flow meter. It is a part of pulmonary function test. Peak flow meter. Yes, you can do peak flow meter also. So what happening this is when you blow air, there will be a graph will show. The graph will look like this. So we are not learning about graph. This is not our thing. But you should, being a nurse, you should know that in order to do the test, you are going to ask the patient to relax. You're going to clip the nostril of a patient. Okay. So only the mouth is used to exhale and inhale. One more thing, you're not going to give any kind of bronchodilators or bronchodilators before the test. Okay. So what are the bronchoconstrictors? Anyone knows? Ice cream. Any cold?
Our bronchitis.
Yeah, so any kind of bronchoconstrictor, you're not going to give any kind of drug which is like cholinergics. You're not going to give them cholinergics. Okay.
Yes,
so no cholinergics, no caffeine, no cola, no coffee, no stimulant at all. Okay, simple patient, normal patient, and you have to you're going to like pinch their nose. Okay, so this is all. So 3 readings are taken, right? 3 readings are taken. The best one is assessed. Okay, cool. Next, I want to teach you about a device. Okay, it is a kind of pulmonary function tank peak flow meter. It comes in a reading of red, yellow, green. So listen, every time if a patient is outside its hospital, okay, so we are not going to keep permanently asthma patient in the hospital. After some time, patient will get discharged and have the normal life. And some kind the patient can get triggered by any kind of allergen, and then asthma can exacerbate. Okay, how will we know that being at home? How will we know that the asthma is getting exacerbated? In order to understand this thing, there is a peak flow meter, which is a pen-like device present at the home. So it is present with the patient. So how do we know that asthma is getting exacerbated? We ask the patient to blow air into this thing. If it come in a green zone, it means that the patient is having no asthma exhalation. We will ask the patient to kindly just take few deep breaths and the patient will fine. If a reading is coming under yellow zone, that means you need to monitor the patient and you need to assess the patient. If it is in the red value, it means that the patient is having asthma exacerbation and you need to give them albuterol, that is your rescue inhaler, and the patient is immediately sent to the hospital for further treatment. Okay, understood? So let me show you that peak flow meter now, so you can just have a clear picture of this. Can you see this? Red, yellow, green. So this is how exactly. You see this is how this is used. Asthma is not good, getting worse, give albuterol. What is this happened to just now? Okay, this is the whole thing. Green means that your lung capacity is your 80 to 100. Yellow means 50 to 80 and red means less than 50. Okay, it means it's dangerous. Go to the hospital, get albuterol, and you need and medical emergency. Okay, this is what is a peak flow meter look like. You know what? Why this is in green and red and blue color? Because we understand color very easily as compared to
Like
values. So that's
we
why it
have
is in
like our triage color, so same they put of this.
yeah, we
So we
have
can
same as a triage. We have same
triage.
as the red line and green line that we use in traffic light. So this is the basic of this thing. Okay, let me teach you about that. Let me show you the PFT machine also. Okay, so this is how the machine look like. Okay. Not working. Just give me 1 second. Okay, leave it. Did you understood what I'm talking about? Do I need to get in depth? It's no need to get in depth. This is what the basic. Okay. Next, let's learn about spirometry. Any one of you have ever used spirometry or ever taught the patient to use spirometry?
I just had the surgery ma'am recently. Then after post anesthesia, they give this to me.
Listen, spirometer is given after every surgery.
Every surgery, yes.
One thing where he'll write it down, spirometry is given after every surgery. Second thing is important that if you not give spirometry to the patient, you know how the patient will take breath. Like,
yes,
they will sit and they will not take breath because they will sit like, and they will not take breath. Their alveoli get squeezed out and it can cause atelectasis to the patient, which is itself is a medical emergency that we don't want. We don't want their alveoli to get affected due to the medical negligence. Okay, so that way understand one thing, spirometer is given to every patient just in order to make their lung compliance. Okay, compliance to the airway. So understood one thing. So spirometer look like a, this is the device. There will be 3 balls present into this, ball number 1, ball number 2, with different type of cc, different type of volume. Okay, okay. And there will be 1 tube. Okay, like this. Can you tell me, do you breathe out into the machine or do you breathe in into the machine?
Breathe in.
Ma'am, in the machine.
In the machine.
The machine, ma'am.
So will you suck air? Okay, tell me one thing. Do you suck air into the machine or do you suck out into the machine?
Into the machine.
Ma'am, simply we inhale it. We put the machine in the mouth and we inhale it.
Farhad, keep it
Ma'am, I
humble.
said simply we put the. Ma'am, I
Do
said
you blow air into the machine or do you take into the air into this? Will you suck in or blow out?
Ma'am, I
Simple
said.
one.
Ma'am, I said simply we put the machine in the mouth and inhale it.
Karvanjit, how did you use this machine in the hospital? How did you make your patient to use this machine in the hospital?
ma'am, first they will ask for the take a deep breath. Then we will exhale to that mouthpiece what we have with this pipe. Then with that exhale, the balls will goes up.
Yes, this is the thing I really wanted to make sure. When I was teaching a group of nurses 1 or 3 weeks ago, I asked the same thing, and they were like, "No, ma'am. Actually, what we actually do, we ask the patient to blow air out. This is the maximum nurse which are doing this thing, and this is wrong. Kalvanjit, you will not go to do like this thing. This is the wrong practice. You will ask the patient to suck air in. You are just trying to increase the vital capacity of your lungs. You're asking your lungs to use. You're asking your lung muscle to expand. So you need to pull air into your lungs and you need to hold them. This is what exactly you want. Because if you not do this, there will be a closure of small airways. This we don't want. Okay, this will keep your lungs open. So what you will do? You will take the mouthpiece into your mouth and you will... Okay, what? Anyone?
Ma'am, Priya's phone is on mute. She's talking.
Priya, anything? You want to say something? Priya, Farhad. Okay, one Priya is me. Wait a second. Okay, leave it.
Actually, this is the 2 practice will do, sir, madam. Inhale and exhale. 2 practice will guide to patient.
Yes, but the primary purpose of your spirometry to inhale air, okay, and to hold the balls.
Yes.
This is what we are going to ask the patient to do. Okay, and then simply blow. This is what we actually practice. And why there's incentive? Do you know what this is known as incentive spirometry? This is not the word is incentive. Incentive. So why do we use incentive word? So when we keep the balls up for longer duration, it is act as incentive for us. Like, okay, so just imagine Fatu, Rupa, and Shashikala, and we have Kalvanji. So we have 3-4 women in front of us. I will ask every one of you to do the spirometry. The one who will keep the balls rise for the maximum amount of time, they will win. So this is like incentive for us, right? Keep the balls up. It's like a game for a patient itself. It's a very interesting instrument. So we are acting as the balls. If you're keeping the more time, so we initially we want to keep we really want to just cross our bar every time you use the machine, and this is what exactly happening. That's why there's a term incentive added to this incentive spirometry. Understood? Incentive spirometry. Okay. And okay, so this was all about your asthma. Understood, everyone? Can we
Yes,
just
ma'am.
recall till now what we have studied? Okay, tell me one more, like just start with asthma again. Okay.
Asthma is chronic and it.
Yes, Harupa, please continue.
Okay, then we use a smooth muscle and it has hypersecretion from the mucus, from the.
So sorry. I'm so sorry.
Okay. Okay.
Every time I teach respiratory, this exactly happens to me. So sorry for this. Yeah, please continue.
And we learned about the physiology, how the antigen antibodies work, how it becomes
Let
an
me recap,
antigen.
and you just you just write it down, whatever is necessary for in your writing. Okay. Do you understood? Rasma, you can call it chronic. It is an hyper-inflammatory reaction where is your smooth muscle get hyper-inflamed and there is an hyper-secretions also. So these are the
लड़का नहीं रोवे सनानम
रोजलीन सिकंदर नहीं लड़ रहे हैं. Okay, cool. So you understood what asthma is basically. Listen one thing. NCLEX does not want an exact definition of disease. So there's no point of wasting your time in understanding the definition and memorizing the definition. Clear? Second thing is you need to understand the pathophysiology, which is very important. So if we have discussed about the pathophysiology, you know what is happening in your trachea whenever there is antigen present. So what this antigen will do? It will act as any kind of foreign body, for example, pollen, grain, or our body considers it as antigen. And in order to fight this antigen, our body release so different type of immune mediator cells. First, macrophages will come. Second, your histamines, okay, and your then you have interleukins will come. Then you have tissue necrosing factor, growth factor, okay. Then you have anyone, eosinophil, basophil, neutrophil, different type of cells will come and it will get proliferated very easily, and they will open the airway, not airway, they will just the capillaries, they will increase the capillary permeability and the fluid will rush, and there will be what will bronchospasm, okay, and there will be increase in the secretion. Understood?
Secretion.
Okay. The next thing that you need to understand is, so once there is a bronchospasm or there's narrowing of your airway, okay, so after the we understood what pathophysiology is, and now you need to correlate this pathophysiology and tell me the sign and symptoms. First sign and symptom, the patient will have shortness of breath, which you all call as dyspnea. Okay, it can call as cough. It can cause cough with sputum. Okay, there will be an wheezing sound present. There will be a wheezing sound. There will be a chest tightness. Okay, there will be a use of accessory muscles in order to fulfill the oxygen. There will be a bronchospasm. Yes, bronchospasm can happen. And then we can also have metabolic acidosis. Respiratory acidosis.
Respiratory acidosis.
Because we have an accumulation of carbon dioxide in our lungs, and as carbon dioxide increases, the pH will get decreased, and hence you have and acidosis. Understood it now, everyone?
Ma'am.
Okay. Then we understood some diagnostic tests that we need to do. We can do like IgE antibody test also. This is very
Yes.
specific to understand are we having like asthma,
Immune or non-immune.
spirometry. Okay. Then you can do peak flow meter. Then you can do
Chest X-rays.
chest X-ray,
PFT.
PFT, pulmonary function test. So these all are the diagnostic that you can do. It's very correlated with the topic. Next, can you tell me the type of asthma that we understood till now? Two type asthma. First is very good. Atopic and non-atopic.
And non-atopic.
Non-atopic is caused due to cold.
Especially
And
drugs.
Drug
Induced.
infection. And atopic is caused due to
Allergies, occupational
allergies.
asthma.
Allergy can be from egg, pollen grain, dust, any mite, any kind of allergies. Next, it can cause basically allergies, and yeah, there will be an increase in Ig. Okay, the Ig value over here will be normal.
Normal.
Till now, did you understood about asthma? What do you call it as, Fatu? You call it as asthma or asthma?
Asthma.
Asthma. Asthma. Asthma.
Yeah. What?
Asthma. Yeah. We do say asthma. Yeah, we say asthma.
Asthma.
We don't
I
have the
call it asthma, but I
the
like call it as
yeah, the TH is
What?
silent. So we say asthma. Asthma.
Doesn't matter what you call it. It's what
Yeah.
exactly mattered. Do you understand it or not?
We
So
understand.
I might forget your name, but I will never forget what you mean to me. This is what the essence of your name. This is something. Okay. This is cool things. Yeah. So let's take break and then we will understand about drugs. Okay. Yeah. Break is okay.
Okay, thank you.
எல்லாமே படிச்சிட்டியா? எனக்கு என்னமோ ஒண்ணும் இல்ல.
Okay. Everyone, can you just be on my screen? Patu, Priya, Farhad, Govind Raj, Akib, Umza. One thing I really want to ask from everyone, क्या आप लोग एक दूसरे से बात करते हो ग्रुप में? कभी क्वेश्चन डिस्कशन होता है ग्रुप में? गलत है।
Good evening, madam.
Good
What
evening.
did you say, ma'am?
I want everyone to, first of all, I want all of you to be on my screen. Umza, I know whatever you're doing. Now you have to be on our screen for 5 minutes. I want everyone. So I can just talk to you on a very serious talk. So you have been connected since like 2-3 weeks? Yes or no? Yes. I know it has been 2 weeks. Farhad, Fatu, and Umza. Fatu, I want you also, and Umza also, and Priya also. If you are not talking with each other, if you're not discussing with each other, it means that you are not thinking. And if you're not thinking, it means your brain cells are becoming dead day by day. There are 2 ways to make your brain cell go dead. First, by not giving them oxygen. Second, by not giving them knowledge. And as you're sitting prolonged, slowly and steadily, your brain is depriving of oxygen. And at the same time, you're doing the same thing. So you're making your brain cells go down. And don't come to me later in your life that, okay, our brain is not working and we are having Alzheimer's. So if you don't want to get such kind of disorders later in your life, start discussing, start using your brain cell very effectively. Secondly, if I'm posting some question in the group and there is a zero discussion, it means that you are confining your knowledge towards yourself, which is not a good thing. Knowledge increase when you share with people. And if you're not discussing in group, if you think, okay, this is my brain, what ma'am is talking, ma'am is teaching, we will pass the exam. No, you will pass the exam by utilizing your brain. And the more discussion you do, the more better answer you can get. So even if you don't understand the topic, might the second person, might the Shashikala knows better. You can just talk to her. Okay, is it not audible? I think I'm audible. Yeah, I'm audible. Priya, you see your connection. Okay. So I want everyone to use their brain very, very effectively from today. Okay. If you're not using your brain from today onwards, if you're not discussing in group, I know my questions might be very, very difficult. So today, the question I'm going to give is going to be very, very difficult. So if you're not discuss, you will not get the marks. Discuss. Ask why, and the best thing is to your group. Okay, understood?
Yes, ma'am.
I got my point. Start
Yes,
discussing.
ma'am.
Okay, this is the best thing that you can do for your brain. I'm not talking to NCLEX. The best thing that you can do for your brain is to utilize your brain cells very effectively. Okay, can we just start with the next topic that we are about to discuss? Are you all charged now? Okay, the lecture might go long, so make your back straight and stay to the studies. Okay. Okay. So now we are going to talk about your respiratory drugs. You got a feature of changing colors. No, it's not good. Respiratory drug, specifically your asthmatic drugs. Okay. Okay. Before starting the topic, I really want to understand what are the two major problem associated with respiratory asthma. The first is your bronchoconstriction. Okay. Bronchoconstriction. First in one is your bronchoconstrictor, and the second problem associated with is your inflammation. Yes. The two thing that is happening in your asthma, first is your bronchoconstriction and second is your inflammation. Yes or no?
Yes, ma'am.
Everyone, yes or no?
Yes, ma'am.
Yes.
Yes.
So you need to tackle two problems. First problem is your bronchoconstrictor and the second problem is your inflammation. So in order to tackle this problem, so if your patient is having bronchoconstriction, what will you give? What you will give for heart?
Bronchodilator.
Very good. Bronchodilators. Okay. Yes or no? You're going to give a bronchodilator. Clear? Okay. So in order to understand bronchodilator, you need to understand a very, very specific part of your neuro, that is your sympathetic nervous system and your parasympathetic nervous system, and these all drugs. Do you know your brain, your nervous system is divided into how many parts? Yeah, audio on karo, mujhe bolte raho mere saath. Your brain, your nervous system is divided into how many parts?
Central nervous system, peripheral nervous
Very
system.
good. Central nervous system and peripheral nervous system. Your central nervous system is divided into? Batao, basic.
Sympathetic and non-sympathetic.
Acha.
No, that is peripheral.
Central nervous system is divided into Farhad.
Brain and spinal cord.
Brain and spinal cord.
Good. It's divided into brain and spinal cord. Yes or no? Brain and spinal cord. Your parasympathetic nervous system is divided into autonomic nervous system and somatic nervous system. Yes or no?
Yes, ma'am.
It is divided into somatic nervous system deal with your visceral organ that we're not talking right now. We are talking about autonomic nervous system. What do you mean by automatic? Do you have automatic washing machine?
Yes, ma'am.
Everyone is having automatic washing machine in there. If anyone who do not have washing machine, that is me. Okay. Just jokes apart. So you know what automatic means? Automatic means something is happening by its own. You don't need to do anything for it. Yeah. You just need to keep your clothes into it. It's going to wash it, it's going to dry it, and you just need to take it out. Same thing is happening in your body. Your autonomic nervous system is divided into two parts. First is your very good sympathetic nervous system, and second one is your parasympathetic nervous system. So there are two nervous systems which are working together in order to keep you alive. Basically, autonomic nervous system is the nervous system which keeps you alive. Okay. So tell me one thing, whenever you see a cat, no, not a cat, when you see a dinosaur, what you will do? Shashikala, what you will first reaction? No, Shashikala will take out your phone and click photo, selfie with the dinosaur and post it. Nowadays, things are happening like this.
That's true, ma'am. Nowadays.
That's true. But what exactly you should do?
Run away.
Your sympathetic
Anxiety.
nervous system will get activated, and your sympathetic nervous system is governed by two major neurotransmitter, that is your epinephrine and non-epinephrine. Yes
Epinephrine
or
and
no?
norepinephrine.
Simply,
Yes, ma'am.
your body will release epinephrine from your what? From your what?
Neurotransmitters.
कहाँ से आएगा? Neurotransmitter आएगा कहाँ से? Your neurons, which are basically your sympathetic nervous system, the nerves will release your epinephrine and non-epinephrine, and some part will be released directly into your blood through your adrenal gland. You know, adrenal gland produce your epinephrine and non-epinephrine part.
Yes, ma'am.
The cortex of your adrenal gland produce epinephrine and non-epinephrine. Okay, can you tell me which are the receptors which are going to receive this epinephrine and non-epinephrine? Receptors of your, if your receptor of your sympathetic nervous system. Alpha and beta receptors. Okay, you must be knowing of this fact. Yes or no? Do you know this fact or no, or not? So I can explain you better.
Forgot, ma'am.
There's something called yes. There's something called no.
I forgot, ma'am.
Okay, just say you forgot or you don't know. Simply, I can explain you more. So understand this thing. Just imagine this is your nervous. This is one good neuron. Array. So this is one good neuron. Okay. So this is an ending. Okay, I'm just making a rough diagram. And there is a receptor. Okay. So these neurons will release epinephrine or non-epinephrine. Okay. And there will be receptor presenting. Okay. So, for example, there is, I don't know how old you are. So when I was very young and I was a kid, so there used to be antennas in our house which collect transmitting sound, and it was made up of aluminum like this, and it was adapted in the rooftop where there is signal which comes and collect the signal and which we can see TV.
Yes,
Do you
ma'am.
remember those days? Everyone, Farhad, was there also in your country?
Yes, madam.
Fatu, was this also in your country? I think we all know what I'm talking about. So just imagine similarly, the signals which are transmitted in the air are collected by antenna. Similarly, the signals are throughout your body secreting signals in the form of epinephrine and non-epinephrine, and there are certain receptors which are receiving this signal and making your changes in your body. So these receptors will receive the signal and they will do something in the body. So the signal which receive your epinephrine and non-epinephrine's are alpha and beta receptors. Till now, did you understood?
Yes, ma'am.
Understood?
Yes, ma'am.
Okay. So coming back to the topic, so till now we understood that the sympathetic nervous system secrete the neurotransmitter which is called as epinephrine and non-epinephrine, the receptor which is called as alpha receptors and beta receptors. Okay, and now understand one thing: these alpha receptors are further divided into alpha 1 and alpha 2, and these beta receptors are further divided into beta 1 and beta 2. I'm not going to discuss all of them because it should be have completed in the neuro. But let's talk about one receptor which is present. This is called beta 2 receptors. Understand one thing, the beta 2 receptors is present in your lungs. Okay, so this is your lung. If I'm making this beautiful lung over here, okay, so the beta 2 receptors are present over here. How do you remember beta 2 is present in your lungs? Do you know that we have two lungs? Everyone have two lungs? Yesterday we checked it out. Both lungs were going up and down. So we all have two lungs. So your beta 2 receptors is present in your lung. So whenever epinephrine and non-epinephrine is going to get attached to this beta receptors, what do beta receptor do? Beta receptor make your airway dilate. So whenever there is a dinosaur behind you, you will run. When you will run, your body need more oxygen. So in order to fulfill the oxygen requirement, Airway go dilate, your airway dilate.
Dilation.
Yes or no?
Yes,
Airway
ma'am.
Yes,
dilate.
ma'am.
And who make your airway dilate? This is the beta receptor which keeps your airway dilated. So one part of the thing, did you understood beta receptors?
Yes,
Yes
ma'am.
or no? Beta 2 receptors, you
ma'am.
understood what is sympathetic nervous system now?
मैडम ये
Okay.
बीटा
Yes.
रिसेप्टर 1 जरा थोड़ा सा रिपीट करें.
बीटा रिसेप्टर 1 क्यों समझना? बीटा रिसेप्टर 1 हार्ट में प्रेजेंट होता है, ये हार्ट रेट बढ़ा देता है और आपका बीपी बढ़ा देता है, ठीक है? और भी बहुत सारे पास में होता है, कहीं कहीं पे ये बीटा 1 रिसेप्टर आपकी वेजो कंस्ट्रिक्ट करता है, कहीं कहीं पे वेजो डायलेट करता है, डिपेंडिंग
ओके
ऑन द
मैडम.
लोकेशन, डिपेंडिंग ऑन द रोड. ये स्मूथ मसल को क्या करता है? रिलैक्स करा देता है, बहुत कुछ करता है,
रिलैक्स
ठीक है?
करता है.
ताकि मोर यस, जो कि पेरिफेरीज को कंस्ट्रिक्ट कर देता है जीआई में, या जीआई को स्लो कर देता है, वहीं पे आपके जो मसल वाली जो चीजें हैं उनमें एयरवे, वहां पे वो रिसेप्टर एक्टिवेट करते थे. डिपेंडिंग ऑन द डिफरेंट लोकेशन दे हैव अ डिफरेंट लोड, बट primarily we are talking about respiratory, so you need to just think about respiratory. When I will talk about cardio, I will teach you about cardio. Okay, then I will talk about beta 1 receptor, and then I will further way I will talk about alphas over there in cardio. Okay, understood? Till now, did you understood that your nervous system is divided into two parts, brain and central nervous system, peripheral nervous system. Central nervous system, brain and spinal cord. Periphery is your somatic and autonomic. Autonomic is nervous system divided into further two parts: sympathetic nervous system, parasympathetic. The sympathetic nervous system
Sympathetic and
basically,
parasympathetic.
yes, similarly your sympathetic nervous system, basically sympathetic neurons release your epinephrine and non-epinephrine, and the receptor is your alpha and beta. Alpha is further divided into alpha 1 and alpha 2, which we will mostly discuss in your cardio. The beta is divided into beta 1 and beta 2. We are currently discussing about beta 2 receptors, which when get activated, it's going to dilate your airway, and this is what we exactly want in asthma. Did everyone understood till now?
Yes, ma'am.
अपनी किडनी अपने लंग से भी पूछ लो, क्या उनको भी समझ में आया, जिनको हिंदी समझ में आ रही है? चलो, let's discuss. Okay. So one drug we have discussed about your beta receptors, basically your beta 2 agonistic. What do you mean by beta 2 agonistic? What do you mean by agonistic? Anyone tell me what do you mean by agonistic? Yes. Anything which mimic the action of epinephrine and non-epinephrine, it is called as beta 2 agonistic, which is called as beta 2 agonistic. Okay, so just understand this is a beta receptor. So if epinephrine is getting attached to this receptor, it is making your airway go widen up. So similarly, there could be other drug which will get attached to this receptor and make your airway go wider. That's exactly what we want. So right, the drug which is called as bronchodilator, the first category of bronchodilator is your beta 2 agonistic, or beta agonistic. We can shortly write this as. Heard our subject about SABA and LABA. SABA is short-acting beta agonistic. LABA is long-acting beta agonistic. You don't have to go in much deeper what a different type, but I'm giving an example of this drug. Remember it like this. Okay. First of all is your salbutamol. Did everyone heard of this drug salbutamol?
Yes, ma'am.
Do you now understood if I give salbutamol to a patient, what is going to do with the what is going to do to your respiratory? Very good. Dilator. Yes. Second is your terbutaline, bambuterol, terol, all the drug ending with terol. Just remember all the drug ending with terol. Okay? Understood? Any other? Phenoterol. Okay. Salmeterol, folmeterol. So these are the drugs. Okay. Now understand one very, very clear thing. Among all these drugs, your albuterol, write in capital, write down in capital. Albuterol is a rescue inhaler, rescue drug. Whenever a patient is having asthma attack, albuterol. Any acute case of asthma, you're going to give albuterol, nothing. This is the short-acting drug, which is exactly what we need now. Salbutamol, salbutamol. No, I'm talking about albuterol. Yes, albuterol. Albuterol is your rescue inhaler. Okay? Understood? Albuterol is your rescue inhaler. Did you write this down? Okay. Understood till now? Did you understood what SABA and LABA is? I went into the very detailed, very basic, but I really want you to understand this drug. Okay. Did you understood?
Yes, ma'am.
Yes,
Okay.
ma'am.
Okay. Then write one very, very important thing. If you're just write few point about these drugs. Okay. So are these drugs are sympathomimetics? Yes or no? They're acting as your sympathetic nervous system. They're mimicking your sympathetic nervous system. Can you write as sympathomimetics? Yes or no? Can you write this as sympathomimetics and just if you will not sit with me and understand, then how do you think that I will see? Because I can only see few faces on my screen. Secondarily, nobody is responding. Either you are not understanding anything or you're understanding everything.
We are good, ma'am. I'm good.
They are understanding now.
Yes. Just give some
Yes, I'm also
acknowledgement.
understanding.
Please speak then, okay? Just imagine you are a student of 3rd class and I'm teaching you ABCD and you're just understanding with me, okay? Just be like a 3rd class. Okay, next, sympathomimetic. So whenever your body undergoes sympathetic nervous system, your heart rate go up. Your heart rate goes up. So this is the side effect of this drug. Your heart rate goes up, your BP go up, you will increase sweating, there will be increase in the sweating. There will be a bronchodilation effect that we exactly want. Okay, this will decrease your parastatic movement in your body. Your heart rate goes up, your BP goes up, you increase in the sweating, there is an bronchodilation, there is an decrease in the parastatic movement of your body, hence it can lead to constipation. Okay, it can cause 3 T's: tachycardia, tremors, and tossing and turning. A patient get very irritated, agitated. Okay. Okay. Trembling. It can patient trembles, shakiness, tremble. Okay. Next, increase in BP. It can also increase your blood pressure, headache, tachycardia, dysarrhythmias. Next. These are the side effects of this drug. Second is it is avoided in
Ma'am, do we have to learn
diabetes.
about what dysarrhythmia will come in this drug?
Understand one thing, the beta receptors are also located in your heart. So once these, so there are some kind of drug which work for both the receptors which are present in your heart as well as the receptor which are present in your lungs. So when we give such kind of drugs to the patient, it can just cause the similar effect in your heart. So your heart rate increases. Okay. So, and when your heart rate increases, your BP increases. Okay. So when your BP increases, it can cause, so whenever beta receptors are present, you must have heard this beta blockers in antihypertensive drugs. Okay. So beta blockers are also as antiarrhythmias also. They can call it antiarrhythmic. So when you just trigger this beta receptor, so they can be changed in the normal pattern of heart beating, and hence you can have dysarrhythmias. Okay. Understood what I'm basically saying?
Yes, ma'am.
Okay, that's why there's a dysarrhythmia present. Okay. Next, understand one thing. Avoided in diabetes. If a patient is having diabetes, you are not going to give this drug because this decrease the insulin level and hence your diabetes can get very affected. You are never going to give this in hypokalemia. Write down in capital letter. It is very important to understand that this drug is contraindicated in hypokalemia. What basically is someone is unmute. Just mute yourself. This causes disturbance. Okay. Yes. This is highly contraindicated in hypokalemia. Okay. If BP is increased, do not give. Okay. If heart rate increased, do not give. Similarly, if there is an dysarrhythmia, do not give. Do not mess with these drugs. Understood? Okay. Next, we're going to talk about the next class of drug, which is known as, okay, which is known as anticholinergics. First of all, let me go to this part of it. Okay. Are you all with me? Anyone who's sleeping in class? Can you all hear me?
Yes, ma'am.
Yes, ma'am.
I'm a person who love interaction. If you're not talking with me, if you're not saying yes or no, it means that I'm talking to some wallpapers in front of me. Okay, don't act as wallpaper, beautiful wallpapers. I want these wallpapers to talk with me also. So, okay, don't be static. Okay, coming to the next part, as we have discussed about, your peripheral nervous system is divided into your sympathetic nervous system.
Sympathetic nervous system.
No, these are divided into autonomic nervous system and somatic nervous system. So your autonomic nervous system is further divided into your sympathetic nervous system that we have discussed. Okay. And the second is your parasympathetic nervous system. So what do parasympathetic nervous system do to your body? Basically, parasympathetic nervous system helps you to sleep, to digest and rest. Okay. Right now, I am talking, I am putting it there. So I am in sympathetic nervous system and you all are in parasympathetic nervous system. Because you're thinking of sleeping, you're thinking of eating, and you're thinking of resting.
Eating and
that's why.
resting.
Okay. So parasympathetic nervous system helps your body to sleep, digest, and rest. Okay. The neurotransmitter is acetylcholine. The neurotransmitter is your acetylcholine. And yes, and the receptors are your nicotinic receptors and your muscarinic receptor. So there are two types of receptor which get stimulated by your acetyl, that is your nicotinic receptor and your muscarinic receptors. Okay. So there are two types of receptors, nicotinic receptors and muscarinic receptors. So these muscarinic receptors are of 5 types that we are not going to study about. Okay, do not worry about this thing. And this nicotinic receptors are of 2 types, NM and NM. You don't have to read about this thing. Just understand these are the 2 receptors which get influenced by acetylcholine. So whenever these receptors get affected by acetylcholine, what they will do? They will contract your airway. They will contract your airway. Now, we want a drug which block this effect of acetylcholine on this neurotransmitter. So, we want a drug which block this effect of this acetylcholine. So, we will give as anticholinergics. So, cholinergics, parasympathetic acetylcholine, you can call it cholinergic also. Acetylcholine is also known as cholinergics. So whenever cholinergic will bind to this receptor, it will make your receptor go constrict. So you want a receptor which block this receptor. You want a drug which block this receptor. So acetylcholine or choline cannot bind to this. So which will just drug will known as anticholinergics, which act opposite of the cholinergics. And when you will block this receptors, you will make your airway wider. You will make your airway go wider, which is drug. The next drug we are talking about is your anticholinergics. So anticholinergics make your airway go wider. Understood?
Antidilator, ma'am.
Yes, bronchodilators. These are anticholinergics are bronchodilators.
Bronchodilator, nitroglycerin like.
Yes. Okay. Can anyone name some anticholinergics to me? Anyone? Ipratropium bromide. Have you ever heard of this drug?
Yes, ma'am.
So write it down. Anticholinergic is your ipratropium bromide. Is your ipratropium bromide. Okay, any other drug which you remember? I don't think this mostly the common drug which is used is ipratropium bromide. Yes. So this is also used, yes, but a very rarely this drug is used.
Very rare.
So yes, very rarely it's used. So ipratropium is a drug which is mainly used for your actors anticholinergics, which widen up your airway. Okay. So as we're talking about ipratropium bromide, write few things about this drug. First of all, this is anticholinergics. Second of all, these are anti-secretory. Secretory. Second is these are your sympathomimetics. These are your sympathomimetics. They mimic the action of sympathetic nervous system of your body. So can you tell me the side effect? Anyone remember the side effect?
Dry mouth.
Very good. Dry mouth. As they are anti-secretory, so they will cause dry mouth. Very
mouth.
good. And most of the asked question. Dry mouth.
Urine
Yes.
retention.
Yes. Fluid retention. Dry eyes.
Yes.
Fluid retention.
Increase heart rate.
Very good. As they are sympathomimetics, so they can increase your heart rate. Yes. Next.
Yes.
Increase
Next.
blood
Dry
pressure.
mouth. Can they cause constipation? Yes. As your
Yes,
heart
ma'am.
rate increases, your BP increases. Can they constipation? They can cause constipation. They can cause headache and nausea and vomiting are the classical sign of every drug. Headache, nausea, vomiting. Headache, nausea, vomiting. This is all we have read. Okay, so these are the drugs. Okay. 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 Write one thing. Whenever there is a dry mouth, I got a question in NCLEX which were asking about dry mouth. There was a drug which is side effect of the dry mouth. So what you will manage the dry mouth with? You're going to give sugarless candy to the
Sugarless
patient.
candy to chew.
Very good. Ice chip.
Yes.
Okay. Next, sip of water.
Sip of water.
Okay. As we have dry eyes, so eye lubrication every 2 hourly. Eye lubrication every 2 hourly. You are going to prevent the direct sunlight in the eyes. Okay, because eyes are very dry. If the eyes are dry, they can lead to conjunctivitis. Okay, because the tears have lysosomes in them, they prevent bacteria. So no tear, no bacteria prevention and the hand can. So you need to keep a very eye precaution. Okay, so whenever there is an eye problem, this is a sensory organ. So whenever there is a sensory defect in your patients, you're going to keep on fall precaution. Understand, these things are your priority in your NCLEX. If you don't know that anticholinergic is called dry eye and you need to keep a patient on fall precaution, you're not going to pass the exam. I'm telling you very, very straightforward, very, very strictly. Okay. Okay.
Ma'am, there is a early sign.
Sorry.
There is a early sign. That is early signs. Headache,
Early sign
vomiting,
of,
nausea. Can you
yeah,
hear me?
patient can have diarrhea with it, but
Diarrhea? No,
not
no,
diarrhea.
no.
Patient can have
Dehydration.
constipation, headache,
Dehydration.
nausea. Yeah.
In that case, the patient going to be a dehydration, and there is early sign like eye dry and fluid retention. There is early sign. I'm asking about the early sign or a late sign.
Listen, there is no such early sign or late sign. Okay, these are side effect.
Side
So
effects.
these
Okay.
side effect means these will be expected in a patient. If a patient is taking ipratropium bromide, these are an expected side effect which will happen. They will be in a dry mouth. They will be in a
Okay.
urinary retention.
These are
Okay.
side effects.
Yeah,
Not
these are side effects. They are not toxic effect. Okay, I'm not talking about toxicity. They will be
okay.
present. That's why we are managing this side effect. Okay.
Okay.
Okay. Next. Okay. Next. All anticholinergics are highly contraindicated in BPH and glaucoma. Write this down in your brain. Contraindicated in anticholinergics are contraindicated in BPH and your glaucoma. BPH and glaucoma, they're highly contraindicated in this. Okay. One more thing, anticholinergics are bitter in taste, so you can give with them with applesauce. Anything in NCLEX which is bitter in taste are given with applesauce until analysis is contraindicated. Anything which is bitter in taste are given with applesauce in NCLEX. Okay. In India, we don't have any applesauce. We have just Kisan sauce, ketchups. I don't know. Hindi makes. Okay. Write it down. Side effect. What will the side effect? More side effect. Tremors will be there. They will be increased in the glaucoma. They will increase glaucoma. What is glucose? Okay, they can increase glucose level. So these are highly. You will not give it diabetes also. Okay. Diabetes के साथ भी नहीं pain. Okay. One thing, write it down very clearly. Ipratropium bromide. If a patient is having allergy from peanut, do not give ipratropium bromide. Understood?
Okay.
Okay. Okay. Now the next drug which we are going to.
Ma'am, wait, ma'am, please, ma'am.
Yeah, I'm waiting for
I
you.
just want to.
Yes. The next drug that we're going to talk about, your methylxanthines. The next drug that we're talking about is your methylxanthines. Okay. Okay. Can anyone tell me what is the name of methylxanthine? Anyone of you, if you know?
Ma'am,
Theophylline, aminophylline,
and
terephthalane.
aminophylline.
Yes. Theophylline, aminophylline. Okay, any other?
These two names are there.
Give me 1 second. Yes. Okay. Yes. Understand this thing. These methylxanthines comes with a very narrow therapeutic range. That is 10 to 20. Very narrow therapeutic range. That is 10 to 20. Okay. They cause, please, anyone, just mute yourself. Okay. Okay. Yes. So they are contraindicated in pregnancy and breastfeeding. They are contraindicated in pregnancy and breastfeeding. Okay. Whenever you're giving this drug, do not give this drug with any other medication. Okay. This drug goes single. Do not give it cimetidine or ciprofloxacin or any other drug. Just give this drug very alone. Okay. Next, Side effect, basically this drug is very psychoactive. So you can write it in a bracket that this drug is psychoactive. So it can cause your neurosign like seizures, fainting, patient can faint. Okay, it can cause dizziness. So this is a very neuroactive drug. Okay, sleepiness. So you know what, coffee is a neuroactive substance. Okay, so whenever you drink coffee or eat coffee flavored chocolates, it can cause you insomnia. Okay, insomnia, your dizziness, your seizures. Okay, so this is the drug. Okay. So till now we have discussed about the bronchodilators. Okay, we have discussed about the bronchodilator. So there are 3 bronchodilators. First one is your
Nitroglycerin.
first one is your
Nitroglycerin.
Intropropamide.
short acting beta
Sure.
agonistic. Okay.
Second
Second is your very good
Beta 2 agonist.
anticholinergics. Third is your methyl xanthine. You can write it, we can remember it with an AIM. A for albuterol, which is a rescue inhalator. I for ipratropium bromide, which is anticholinergic. M for methyl xanthines. AIM. Okay. Listen,
Ma'am,
class, if you're not, yes,
what about sympathomimetics?
sympathomimetic is your SABA.
Sure.
Short-acting beta agonistic is a sympathomimetic. Beta agonistic. Albuterol is a sympathomimetic. Even anticholinergic ipratropium act as sympathomimetics. It also mimic sympathomimetics. Okay.
Okay.
Understood? Third one is your methyl xanthines that we have discussed, neuroactive drug, bronchodilators. So these are your bronchodilators. Understood? Understood everything about these drugs. The first problem of asthma we had tackled. Now the second. What is the second problem of asthma? Inflammation. Sorry? Inflammation was the second problem, right? So we are going to get anti-inflammatory drug. Okay. Okay. The first is...
Ma'am, I have a question.
Yes,
Asthma
please.
and ARDs, which disease? In this disease, we cannot give beta blocker or bronchodilator drugs.
Muhin, I just appreciate that you asked the question, but isn't talking about COPD right now.
Okay. Okay.
No,
They
there's no point of jumping from one topic to another topic. If you understand one thing, kindly understand the topic in depth. I respect that you asked the question and it came, but if I'm in the middle of something, if I continue discussing the topic, so I will be off from my branch that I don't want. Okay. I will answer this question once we are end with the topic. Okay.
Actually, this disease similar with asthma, so that's why I asked you.
Technically, it is not.
Okay.
It is not.
Okay.
Okay. So let's not get confused right now. Let's be on our topic. Let's study about inflammatory. In the last, I will ask you doubt. So any doubt which is away from this topic, please ask in the end. Any doubt which is correlate with this topic, I would love to listen right now. Okay. Okay, because we have a shortage of time if you understand this thing. Okay. The first thing we are going to study about the first anti-inflammatory property is your corticosteroids. Yeah, your corticosteroids, which basically produced by your body also, which has an anti-inflammatory property itself. You know, you have corticosteroid, glucocorticoid, mineralocorticoid, steroids from your adrenal gland. They secrete steroids. So these steroids itself has an anti-inflammatory properties. Few men also take steroids, anabolic steroids to build muscle. Isn't correct, Farhad?
Yes, ma'am.
Boys take steroids to build their muscle.
Yeah, ma'am, but I did not look.
You don't know about this fact. I know you know about this
No.
fact. Girls, do we
Ma'am,
know
I
about this
know.
fact? Yeah.
I know,
Yeah.
ma'am, but I never took it.
Yeah, don't take, okay? I'm just giving you. Okay, so steroids, corticosteroids are your betamethasone corticosteroids, okay? Your betamethasone, okay? Hydrocortisone, okay? Or you can like beclomethasone,
Beclomethasone,
yes. And then so many others, but we're just sticking to the two of them, okay?
predni,
So these steroids have an,
prednisolone.
okay, one thing. First of all, whenever we are talking about steroids, they have so many side effects, which is your homework. We are going to read about steroids and their side effect, okay, in depth, because steroids are come in every second question that we're talking about. So you need to get very much aware of steroids. So the side effect of steroids are your adverse effect. I will call it as adverse effect. Cataract glaucoma. Write it down. Cataract glaucoma. It can cause as hypertension. Okay. It can cause as pancreatitis. There's so many side effects. Basically, so many side effects with this.
Hyperglycemia is also.
Yes, hyperglycemia. Very good. Hyperglycemia. Growth retardation. Immunosuppressant property.
Weight gain.
Weight gain. Yes. And yes. Dermal atrophy. Your skin become very dry. Dermal atrophy. Okay. So these are the general side effects that you know. One thing I want to take this is whenever patient take betamethasone through MDI, meter drugs inhaler, you must be aware of that pump that we take through canister. So it can cause oral thrush in your mouth. Oral thrush. Oral thrush. Oral thrush. Okay. So in order to prevent this oral thrush, you can give patient nystatin. Okay. And after every use of betamethasone, you are asked patient to rinse their mouth with antiseptic solution and clean the bottle, clean the mouthpiece of your MDI. Understood? Can you write it down? Okay. The second anti-inflammatory drug is your mast cell stabilizer. Mast cell, which mast cell I told you, it is an immunological mast cell. Mast cell inhibitors. You're going to give patient mast cell inhibitor. They're very few. If you want to learn their name, you can learn. But first in is your nidochromyl, okay, nidochromyl or ketotifen. Just remember this word. You don't have to memorize them. Just the word. These are the very few. I'm just telling you for your knowledge. Not as important as parentheses. Okay. Just telling you for the knowledge. Yes. The second is your leukotriene, anti-leukotriene. Did you remember I told you about interleukins are released during immunological activity? So these are interleukin. Let me write the spelling. Leukotriene. Leukotriene, anti-leukotriene. Did you heard about montelukast?
Yes, ma'am.
Very good. Montelukast. Zafrilukast. Next, Iralukast. Okay. Zafrilukast, montelukast, Iralukast. You can just remember this thing.
Yes.
Yeah, basically what they do, so the interleukins which are released during an immunological activity, so they block the receptor of interleukin. So basically they are anti-interleukin, okay? Okay, write down the side effect of this interleukin are, okay, excessively sleepiness, increase in the sleepiness, okay? And Patient get agitated, hallucination, increased sleepiness. Patient will get agitated,
Dyspepsia.
hallucinations, yes. Sleep disorders,
Yes.
abdominal
Headache,
pain,
nausea, vomiting.
yes. Headache, nausea, vomiting, appetite increase,
Yes.
convulsant, agitated, all neuroscience.
Malaria and
Agitated,
pain.
hallucination, sleep disorder, nervousness, excessive sleepiness, hyperreactive. So these are the side effects with this drug. Next, we are going to talk about one of the very important drug that comes your
NCLEX.
Antihistamines. Okay. Your antihistamines. What are antihistamines? Anyone? Just tell me antihistamine. You all have had antihistamines. Citrazine, levocitrazine,
Yes.
Benadryl,
Allegra.
Allegra, very good. I want to know what this
That's
Allegra.
Loratadine.
Loratadine, yes. Loratadine, very good.
Yes.
Loratadine. Okay. One side effect.
Tripolidine.
Yeah, they cause sleepiness. They call excessively sleepiness. Antihistamine, Loratadine.
Yes.
Next, we have Benadryl. Next.
Brompheniramine.
Yes. Phenylprophenylene.
Yes, ma'am. Diphenhydramine.
Diphenhydramine. Yes.
Dimenhydrinate.
Yes. Any other?
Cyproheptadine.
Yes.
Cyproheptadine.
Heptadine. Okay. So they have a side effect of they increase sleepiness.
Yes,
okay. Drowsiness. Yes.
Blurred vision.
Yes.
Hypotension.
Basically, these are even mostly they cause sleepiness, drowsiness. The most question comes around, revolves around such. Okay, so we are at the end. I know this lecture was long. I have told you earlier. It's going to be a very long lecture. Okay. So, can you tell me about everything that we have studied till now?
Asthma.
Asthma, yes. Pathophysiology of asthma.
Yes.
Understood, everyone? Did you understood the definition? The
Yes.
concerning problem
Yes,
of
ma'am.
this drug? Did you understood the sign and symptoms?
Yes, ma'am.
Did you understood the diagnostic test that we need to do?
Yes, ma'am.
Did you understood the type?
Types of asthma. Yes, ma'am.
Yes.
Atopic and non-atopic.
Yes. Did you understood the drugs?
Yes.
Yes.
Yes, ma'am.
Anticholinergic, antihistamine.
There are the two problems that we have to tackle. First problem is your bronchoconstrictor. The second problem is your inflammation. So, in order to dilate your broncho, you have three drugs. First is your sabalaba. Second is your anticholinergic and methylxanthine. Okay. And your anti-inflammatory, you have corticosteroids, mast cell stabilizers,
We have
anti-leukotriene, antihistamines. You can get on to antihistamines also. Did you understood everything? Did you understood the side effect, nursing intervention, what is anticholinergic, everything in your brain?
Yes,
yes, ma'am.
I want everyone answers. Farhad, Priya, iPhone, we are about to end the lecture. So I want everyone participation.
Yes, ma'am, I understood.
But why
Yes,
are
ma'am, I
you not
understood.
keeping your camera on? You have any problem? Priya, an iPhone? Okay. Any doubt? Now you can ask any personal doubt, any extra XYZ, MYPQN.
No, ma'am, I understood.
Farhad is like, bas theek hai, ho gaya.
Do they have any antidotes, ma'am, for this drugs? Like sometimes, for example, we cannot Impratrolamide, that one.
Get me.
That one we
Don't you
can't give.
think this is the no, Rupa, look at me. Don't you think this wasn't very too much data for you to digest?
I know. I
Can
I
you
got it.
digest
I just want
anything?
one
Why will you
extra
give
one.
antidote? Is there antidote of everything?
No.
Do you have antidote of using lot of phone? No. No, there's no antidote of it. Simple. If there would be antidote, I would have taught you. Simple. Do you doubt? If you think there is antidote, please tell me also. And if there is no antidote, please create antidote because it might help in your medical science. Don't worry, there's no antidote. If there would have been antidote, I would have taught you. I know what's going to come in NCLEX, okay? Hanji?
And there is one more thing that antihistamines. There are two types of antihistamines. H1,
Yes,
H2.
there is two types of
Both have
antihistamines.
different drugs. So which
You
one
don't
should
have
we
to go,
focus?
listen, Farhad, we are not given an exam of pharmacology, okay? I would have gone much more deeper into this. Generation 1, generation 2, classical generation, but maximum everyone had the same side effect, drowsiness. And that we had, why we had created so many antihistamines? Because the only problem that we had with antihistamines were drowsiness. That's why I had created, but ultimately everything has created with drowsiness. If you're talking, there is no question you're going to get in NCLEX that going to talk about different generations of histamines. Okay, that's why I have not enrolled this thing. And honestly speaking, these were I have went into the mechanism of actions of drugs, which is not asked in NCLEX. No question you will get an NCLEX that will talk about mechanism of action. But I wanted you to understand the drug. That way I taught you mechanism of action. I would have gone straight with the drugs and asked you to learn the side effect, but I don't want. That's why I asked you to understand the mechanism of action, and so you can correlate the side effect of this drug. We are not giving the exam of pharmacology. We are giving exam of nursing. So you have to focus on nursing. If you keep on focusing on pharmacology and why the type, why even I can
Question.
go more deep in this. I can go with so many pathways how this is happening, but there's no relevance of this thing. Understand? There is no question which is going to ask such kind of question. They're going to straight what is the nursing side effect and what is the nursing
And the
intervention. Side effect,
nursing
nursing, side effect,
intervention.
nursing.
I do
Don't
have a
go
question.
there.
Can I ask a
Please,
question?
yeah, please
Yeah.
ask.
Yeah, there was this question about the when an inhaler that has both anticholinergic and albuterol when used together, what is the nursing consideration? There also there was this choice A, you rinse them out after using it, and another one was you tell the patient to to inhale after to was it something to hold breath for at least 10 seconds or 1 minute, something like that?
Yes,
What is the
whenever
recommend?
okay, this topic I would have talked about earlier. Whenever we take a drug, we hold our breath into, so the drug can have an action throughout your lungs. So you can have a systemic action. That's why you hold breath for some time. Okay. So I've talked about MDI, meter drug inhaler. In the next part, I will talk about MDI. Then we are going to discuss this thing. Okay, that's why I have not touched this topic. Otherwise, we have to sit for 4 hours. So actually, maximum part of respiratory we had completed till now. We had talked about all the drugs which are going to be respiratory, which was very, very important. We had started with our asthma, which was very important. And within 1 or 2 days, I'm going to complete with you all the respiratory topics. Okay. Listen, one thing. If you're going here and there, like you're just going into mechanism of action, you can go, but you should have at least 1 year of time for you to give exam. If you're given an exam within 4 months, then you can't go
Within
in
3
that day.
months or
Yes, if you're planning to give an exam in 2027, I will appreciate, understand everything. But if you're planning to give exam in 2024, whatever I'm teaching the best, and I'm teaching the maximum which is relevance in all the data about nurses. Okay.
Yes,
So
ma'am.
don't go ahead.
I will.
Actually, ma'am, normally the NCLEX tutor, mostly they are very famous. They will just talk about the, means you are going very deeply to understand us, right? But still means, yeah, because they are just explaining the name of the drug, then side effect, then nursing intervention. They will not, they will just tell 2-3 lines. But you are giving us very relevant knowledge, so we can understand what is the action and what to do and what will happen.
Yes, and trust me, I'm
Yes.
talking just straight from pharmacology book to you. And these are the pharma which are exactly not even the deep pharma. These are the very,
Relevant.
very in-depth knowledge that I'm giving you in 2 hours. No one is going to excel in so much, because I know it makes so much of efforts to put and teach you your receptors, your why this is happening. If you want to test my knowledge, you can, but understand that I have cleared my NCLEX, I have taught NCLEX, so I know what is going to come.
Ma'am, even though they will not means explain what is receptor, what is this, they will just tell the headings and goes to the next. But still, you are giving us all the data to understand the things.
Yes, so please stick to the data, study from that data. I respect your knowledge, you want to learn. I'm very open to this thing, but learning, I'm already teaching you so much, okay? I'm not teaching you BSc nursing, I'm not teaching you MSc nursing, I'm teaching you NCLEX, okay? I hope you appreciate this thing, I hope you understand this thing, and we could have a good, knowledgeable class from this thing, okay? Farhad?
Yes.
And one
Ma'am.
thing I'm making very sure, if
I
you
have-
are
I have
not
one.
discussing, yes, I will talk to you later. If you are not discussing, जो भी समझ में नहीं आ रहा, just go to the group, ask each other, अच्छा ये topic नहीं समझ में आया, क्या तुमने लिखा है? Like, I'm talking in Hindi, I understand. Like, did you understand this topic, what ma'am has taught? I missed something, please can you tell me? There was something, because my notes are going to be very, very small. Understand, I cannot fulfill whatever I'm talking right now in 2 hours. You cannot expect me to write in all in the notes. First thing, you have to understand, you have to write. If somebody is missing, please kindly ask yourself, talk yourself. Some topic might be like Rupa can explain you better, Kavaljit can explain you better, Farhad can. So please talk to each other, have a very interactive class switch among itself, and understand. Okay, my goal is to make sure that everyone among you, if you pass the exam, okay, already you have passed your PSC and your JNM and UNM or anything post basic, okay, you're already a nurse. I'm just polishing you up. This is all you should have learned. I should have given you some topics, okay? Understood?
Yes, ma'am. Yes, ma'am.
Thank you, ma'am.
Should I end the
Thank you
class?
so much.
Was this interactive? Any doubt, any problem? Contact me, call me. I'm available, okay? Have a good day.
Thank you so much,
Thank you so
ma'am.
much.
Thank you.
Thank you, ma'am.
Thank you, ma'am.
Farhad, wait a second. Wait.
Hold on.
Open your camera. Thank you.
Now I've joinning from the laptop. That's why it's written.
It's okay. I can still see you. Listen, one thing, Farhad. Okay.
Yes.
I respect your learning so much, okay? But understand you are giving NCLEX exam. You have to get RN license and then learn. Okay. Secondly, you have to be more interactive in the class, because I can see I know you, Sashikala and Rupa, because you were from there with me from the beginning. So hold yourself, hold your horses, keep calm and learn, okay? Understood?
Yes, ma'am.
I'm not demotivating you. I'm so sorry if it feel like, okay, but I really want you to pass the exam. That's my main goal is to, okay?
Okay.
Thank you.